Hey guys, and welcome back to my channel. My name is Dr. Minnie, and in an effort to give new grads some really key skills and key tools to navigate their new career, I wanted to do a topic that's quite close to my heart, which is euthanasia, because I know that a lot of new grads have never really done this before. You've never been in charge of one, and I don't feel like it's talked about very much at uni. I don't feel like you're kind of given the tools to navigate it that well, so I wanted to do a video purely focused on this one topic in order to make it a lot clearer and give you guys a lot more understanding about how you might want to think about going ahead. I think it's incredibly important, and it's something that I actually really value, and I understand the importance that we have in the owner's life in that moment. Even if you've never seen that client before, you will be remembered for that for your whole career. You may not know you're being remembered for it, but out there they will be remembering you for it, and they will remember that moment and how you treated them and how you made them feel, and there's a lot of ways that you can actually do that really well. I want to give you some tools that will help you have a little bit more of a formula to managing it and to be a little bit more prepared for the things that you might have to say or do, and I think that will make the process a lot smoother and a lot easier for you all. So what I'd like to do is take you through the whole thing pretty much. I want to take you through from start to end. It is a look into how I do things, and obviously I'm just one vet, there's plenty of ways to do this, but this is the way that I find really works for me, and I've always had really good feedback about it, and I do think I've got it down a lot better now. So there are always going to be things we can learn and expand on, and you'll find a way that works for you best, but I wanted to at least give you a framework to work with. I remember my first ever euthanasia was actually my first day as a vet, and it was really hard. There were lots of things I didn't know, so I want to see as far as possible if I can help you avoid some of these pitfalls that I fell into. And even though I think overall it was a positive experience for the client, I felt quite out of control, and that's not a very nice feeling for you as a vet. I want to help you feel a little bit more in control. Let's get started. Here are some things to think about when you see that you have a euthanasia consult coming up. Firstly, do you have an easily accessible crib sheet or price sheet for the cost of euthanasia and the subsequent burial or cremation options? Clients will want to know, and it does help if you have an idea of the cost before you go through with the actual consultation, because it sometimes can be a little bit awkward to have to kind of go outside and come back in, or be typing on the computer while they're waiting, so it can help if you can draw an estimate up or find out if reception has a cost sheet before you go in. Second thing to think about is, does the animal that you'll be seeing require sedation? I personally don't sedate before euthanasia, but I know some vets who do, so it can be a little bit variable. If I know the animal to be quite calm and comfortable in the vets, I probably won't sedate them, whereas if they are upset or frightened, or they don't like having their arm touched or their paws touched when you come to sort of clip their fur for the cannula, then I think sedation is really kind and a nice thing to do, and the owners would appreciate it too. Work out as far as you can if that might be something you need to do beforehand, so you can just get it in your head. I always pre-print the euthanasia consent form so that I have it to hand in the consult room as I'm talking the owners through the process. It's not essential, but I think it can be a nice thing to do, so it just avoids the sort of stopping and the gaps that may appear if you have to go in and out and print things off and collect the printer, you know, all that kind of stuff. So I tend to print it first if you can. I do get boxes of tissues ready. Every client's different. You don't know who's going to find it really hard or not, and I think it's just a nice touch to make sure you're ready for that moment, and I offer them to everyone. They can be a 7-foot burly dude, or they can be a kid. They're all getting tissues from me. I don't assume anything. And that's another point, in fact, to also think about, is that everyone shows grief differently. So I would always approach the euthanasia consult in exactly the same way, with the same amount of compassion for everyone, even if the client themselves seems a little bit blasé about it. Don't feel the need to under-explain things or not show the compassion if they're not showing it, or if they're not demonstrating their sadness. People just process differently. So it's always worth going above and beyond just to make sure that you are accounting for all eventualities. So let me take you through how I would approach a consultation from beginning to end. So I read the notes really thoroughly first, if it's not an animal I've already seen or been involved with, to get an idea of why the animal's coming in for euthanasia, bring them straight through into the consult room, make sure there are chairs there so they're a little bit more comfortable. And I like to open up the conversation by getting their perspective, because even if they know it's the right decision, they still want to discuss concerns with you, and they still want counsel. It really helps to make sure that you have opened up the dialogue a little bit before you go ahead. So I usually say something like, so I understand that Marty isn't doing very well at the moment, and I leave it sometimes just there, because often clients will jump in at that point and start to explain to you, yeah, here are all the ways in which there are problems, this is how he's suffering or how his quality of life is poor, and it'll give you a chance to hear their concerns, and you can then sort of address the concerns or address the things that they've mentioned. You know, it just helps to be empathetic at that point, and I tend to say, you know, I really understand this must be very difficult for you, but it sounds like from what you're telling me that this is the right choice for Marty, and I just really make sure they fully understand that I support their decision, because Ultimately, they want your support as a professional, validate them and empathise with their concerns and experience. Every clinic is a bit different, but I have worked for a lot of clinics. I'm a locum, not just that I can't keep a job down, but in the clinics I've worked in, we always tend to get payment first before the owner leaves. So I also find actually that clients prefer this anyway. Although it's really awkward to talk about money in this context, it is, I think, important to get it sorted before the client has gone through with the process, because I think clients would generally prefer to get it done early rather than have to receive a call afterwards or deal with it later. I will then explain to them the cremation options. Now, I tend to ask the owners if they've had a chance to think about this, because they may have not actually had a chance to think about this or had the information. I just run them through those options and I give them a little chance to think. Generally, most owners will make a decision there and then. You can then inform them of the price and you can inform them that they need to sign the form. I will then explain to them exactly what's going to happen next, which is that I will take their pet to the back to get a catheter in. And I also say that in this time while I'm out of the room, I can get a receptionist to come into the room and they can take payment and then it's all sorted and we don't have to worry about it afterwards, and they can spend as much time with their pet as they'd like and they can just leave whenever they want. We don't have to faff about. I've never had anyone complain about doing it that way, and generally they much prefer it. Now, while you're in the back, I always make sure to get a few things ready as well. You'll need your drugs. I'd always get some scissors in case you need to cut the bandage off if they're going to take their animal home. Make sure you get your stethoscope and any other things that you think you might need. I also always bring a blanket so that the animal is comfortable on the bed, and then I also get a nurse. You don't always need a nurse if you've got a cannula in and the dog's amenable or the cat's amenable, but sometimes it can help to have a nurse to sort of extend their arm out for you, and then when you go back into the room you can just introduce that new colleague to the client so they know everyone in the room at every point. Also, make sure that catheter is patent, so do flush it before you go in and take a little bit of flush with you as well, just in case you need to flush it again. Once the animal is comfortable in the room again, back with the owners, and maybe the nurse is in with me, I always make sure to signpost the subsequent steps. Now, this is the point I think is the most important out of a euthanasia consult, because a client may never have seen a euthanasia, so I think it's really important that you're aware of these subsequent things that may happen so that you can tell the client that and so that you can be ready for them. So really listen up for this one. So I always explain to them firstly that they have a catheter in their vein directly, and that the drug, although it's not painful at all, the process can be cold when it goes in. So sometimes the animal will withdraw its arm and it's not that they're experiencing pain per se, it's just that it's a little bit weird and a bit odd feeling. Don't forget to tell them that it's very quick acting. Pentobarbital is usually effective within 5 to 10 seconds. I explain to them that their animal may go limp or floppy. If the owner has them in their arms, they will feel that happen quite fast. I always let them know that it's normal for them not to close their eyes. So interestingly, this is actually a really cool anatomical feature. The orbicularis oculi muscle naturally is held in the open position, so eyes will not close when you're dead. It's actually true for humans as well, interestingly. That whole thing where they pull your eyelids down in movies actually isn't true. It doesn't actually work, apparently. And same for animals. They will naturally, when they're dead, their eyes will be open. Owners are sometimes not expecting that because I think it's a movie thing. They think that they're going to close. But just keep the owners informed that actually that is not going to be the case. Their eyes will not naturally close. And also, I think most importantly of all, animals will sometimes make twitches or they'll make noises or breath sounds that can look quite alarming to an owner if they've never seen it, because it can sound not very pleasant, but that they are only experiencing a normal part of the process. It is a muscle relaxant thing. It is not that they're conscious or suffering. That is probably the thing I think is most important to signpost to the owner, because I guarantee you if you forget to tell them that, the animal will make a breath even though they're already passed, and it will be really unpleasant for the owner to see, and sometimes can be a little bit shocking for you as well. So just make sure you're aware that that happens, and that if the owner sees any gasping or breathing sounds, the animal has already passed away, but it is part of the process. If you've had to sedate the animal, I always like to tell the owners that the animal can still hear them and they are still aware of their presence, because that is really important to an owner, that the animal still knows that they're there. So sedated animals will still be responsive to sound, and they can still, they understand, I think, that their owners are there. So I like to just let owners know that's the case if I've had to sedate their animal. Also, if you do need a nurse to get involved to hold the animal's leg, make sure you just explain why, because sometimes that invasion of the space with the client and the animal can be a little bit unnerving for the client if they don't know why they're there, because obviously they want to be the only one with that animal at that time. If the nurse is going to need to hold the animal's arm, just let them know, but that otherwise the owner can get with the animal in any other way that they feel comfortable. So whether they want to hold them or stroke their head, just let them know that wherever they want to be is fine. Make sure that you're always giving the options. Never assume, I think, is the reasonable thing to consider in a euthanasia consult, because people experience these emotions in so many different ways. I just make sure to stick to my kind of formula, and if owners are not responding to the way I'm doing something, I will adjust, and you'll get a handle on that. You're obviously, your empaths, you'll work work out how to respond to clients, but I never don't explain all these individual components, because it doesn't matter what kind of client you've got, it's important that you have covered these bases so that you are making the process as straightforward and as understandable as possible. I always tend to ask them at this stage if they are ready for me to go ahead. I think it's always good to give them the option at that stage, because it can still be quite jarring even after you've talked about it for them then to realise that it's actually going to happen. I think it's good practice to flush that catheter one more time before you go ahead, just to make sure it's definitely patent. So after you've actually injected the agent and the animal has passed away, I then tell them that I have my stethoscope and I'm just going to check their animal's heartbeat just to confirm. Once you've listened and you've confirmed that the animal has passed away, this is usually the moment when owners actually get most upset. So if they weren't upset before, this will be the point where they have that little breakdown, because it's often for them only when the heart is stopped that they perceive it to be actual death, even though the animal may have died seconds before that. I always again give the owners the option to spend some time with their animal if they want. Some owners want to do that, some owners want to chat. I've had, in fact, many sort of oddly lovely conversations after an animal's been put to sleep about their life and about their puppyhood and about all the adventures and the trips that they had and all the good memories they have, and owners, yeah, some want to talk, some don't, some want to stay, some don't. I just always make sure I've given them the option to stay. If the owner wants to stay for a bit without you, I let them know that they can leave at any time, or that I'll come back in 5 minutes, and it's up to them. So just give them the options and, you know, see how they respond. So I hope that was helpful. I know it was very specific and pretty step by step, but I actually think that sometimes can be quite helpful when you've never done it before. So you'll pick up your own style, you'll pick up what works for you in the phrases, and these are all things that you'll develop over time, but I think it helps to see how someone else does it. That may give you a little bit more of an idea of how to sort of organise it and how to start talking about it. I think the most important thing to really pick up from this video is the signposting. So the things that you need to tell the client might happen. You're the one in charge of that consult, so although it's quite natural to feel a bit awkward about it because it's a difficult subject, you do really have to do your best to maintain control of the situation and guide the owners through that. So even if you feel a little bit underconfident, at least if you've hopefully watched this video, you'll know a little bit more how to deal with it, and the rest will come with time and experience. Please do like and subscribe. I'm going to be posting videos hopefully weekly. I say hopefully because my life is not a schedulable thing, but I will really try to keep this regular so that you guys know when to expect it. If you have any topics you want me to cover, as always, please just post it in the comments below. But yeah, I hope that was good, and I will see you next time.